It's actually probably the seventh leading risk factor for premature death, at least as of 2017. It does things for tendon inflammation. This is using some of the peptides like BPC and thymosin beta-4. Hair loss. Is it COVID related? Is it just stress related? I don't know if there's some weird environmental thing. It is epidemic. You can take massive amounts of growth factors by using exosomes just because of these little tiny particles that we actually are.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
Exosomes are little extracellular vesicles that are generated by cells. So when you look at stem cells, the way stem cells do their jobs is they contain exosomes. I always like to think about them in little packets of material, and they contain all sorts of stuff to build tissue, right? They have microRNAs, messenger RNAs, they have lipids, they have cytokines, healing cytokines, they have proteins, they have everything you need to basically make skin or make a tendon. They're contained in very high amounts in umbilical stem cells because umbilical stem cells need to grow humans. So exosomes are very, very regenerative. If you look at exosomes versus stem cells, one of the upsides of exosomes is that they have about 3 to 5 times the number of growth factors. So when you look at things you need for repairing tissue, IGF and TGF and things like that, all these growth factors, exosomes contain, if I just take the whole stem cell versus exosomes, I'm getting much less of that growth factor activity of, that we need for actually repairing the tissue. So exosomes are like, you could take much more massive amounts of growth factors by using exosomes just because of these little tiny particles. Gosh, people don't like me on this question. Sadly, there's more and more evidence that there is no safe amount of alcohol. It's actually probably the seventh leading risk factor for premature death, at least as of 2017. Probably 2.8 million deaths worldwide. And that's not just due to your alcoholics who obviously go into liver failure and things like that. Interesting thing was the cancer risk. So cancer risk went up very significantly, even with one alcohol drink. It seems to be alcohol seems to be the worst for younger people. So in that 20 to 40 age group, alcohol was probably even more damaging and more problematic than when you get to be my age group. Alcohol breaks down to what's called acetaldehyde. Acetaldehyde is a really damaging metabolite of alcohol. And we know it's actually a DNA damaging. So that's where it leads to. So it actually damages DNA. It actually breaks DNA in stem cells. And so we actually know that it leads to these diseases that are linked to DNA damage, such as cancers. If you look at people who are drinking even before, so people stop drinking when they're pregnant. Well, what about before they get pregnant, right? Because you're actually altering DNA before pregnancy when you're drinking. So there's certainly much more risk factor of the offspring of people who drink a lot having higher incidences of diseases as well, because now they have some of these inherited mutations. So their cancer risk is increased. So what are your options? Well, one of the cool things you can do is hard ketones. So hard ketones are pretty cool, made by Ketone Aid. They give you a nice little buzz, just like alcohol does. They're nice and soothing, but they're made with what's called R13-butanediol. And butanediol doesn't convert into a toxic byproduct. So basically, when you drink ethanol, it converts into this toxic byproduct, acetaldehyde. But when you drink R13-butanediol, it converts into ketones. So ketones are really good for us, right? Ketones we just talked about, they feed your mitochondria. They help you make more ATP. They help fat loss. They're really good for brain function. They're cancer preventative. So now I'm drinking an alcohol. So this is still an alcohol, but it's a different kind of alcohol that actually has huge health benefits from me. Does taking weekly sirolimus, rapamycin, affect levels of sex hormones in women? And if so, do they still need to take bioidentical hormone replacement therapy? So the hope would be, if we're taking these longevity agents, that we actually are slowing aging of everything, including our reproductive organs, like our ovaries. So we know that ovarian failure is, that's one of the things that's going on as we age. So there were some good mouse studies that showed that indeed you could do that. You could delay ovarian failure by putting on early rapamycin. They had to treat them pretty early to see that effect. I'm a little worried that starting that now, like at my age, and that might be an issue. Now, if you were in your 20s, could you prolong could you keep fertility longer by using rapamycin? Probably. But I think if you're at the stage where you need hormone replacement, probably you're not going to reverse that need. You probably still need the hormone replacement along with it. The number of calls I get for hair loss is astounding. Is it COVID related? Is it just stress related? I don't know if there's some weird environmental thing. It is epidemic, honestly, epidemic. And dramatic hair loss. And all these people are on hormones now. They're all on the same drugs. You just can't put your finger on it, but it's across the board. I think number one, obviously you look at all this stuff, all the hormones and everything like that, and you get those stabilized, but I do that and we still get this hair loss. So what can you do? And the low-dose minoxidil seems to be helpful, even in not the androgenic hair loss. It seems to have some benefits. Thymosin beta-4, we've talked about this before. Thymosin beta-4 is really, really helpful for hair regrowth. It basically stimulates stem cell migration and protease production and differentiation. So that's really what it's doing, is improving stem cell function to grow hair. If you add in a little thymosin alpha-1, so you stabilize the immune system while it's going on, works even better. So using thymosin alpha-1 with thymosin beta-4 can be really helpful for hair loss. Spermidine is great for hair loss, honestly. Spermidine, hair and nails, you'll see your eyelashes grow, your hair grow, your nails grow, especially if you take higher doses. GHK copper, so used either topically, so you can get GHK topical for hair, so you can actually do a little microneedling on the hair and put a little GHK copper on there and do that on a regular basis. There's an interesting drug that just got approved. It's called Olumiant. Keep Olumiant on your radar. It might be an option, even if it's for a short period of time, like doing it for 6 months or so. But remember, we have prebiotics, probiotics, and postbiotics. So prebiotics basically provide the fiber, the non-digestible fiber, to our gut microbiome so that they can make butyrate, which feeds the colonocytes. Okay. So basically, you've got prebiotic, which is the non-digestible fiber that feeds the microbiome. You've got the probiotics, which are the microbiome or drugs you take to replace the microbiome. And then you've got the postbiotics, which are things like butyrate, right? So those are kind of the three pieces that you need in terms of gut health. So remember that prebiotics are these non-digestible plant fibers, and those are what really feed the good bugs. So if you're following a totally keto diet where you have zero fiber in your diet, potentially, you might not be feeding the good anaerobes in your gut, and they're not making butyrate. If they're not making butyrate, the colonocytes aren't happy, and they then start creating more of a leaky gut type picture, and now you have a more aerobic gut. So you don't have good anaerobes anymore, and the whole process gets screwed up. So prebiotics are really, really, really important. And you can buy prebiotics like inulin fiber, things like that. But basically, food sources, onions, garlic, sweet potatoes, dandelion greens, green banana. Plasmalogens are sort of these kind of specialized lipids. And they're everywhere, but they're very, very robust in the brain and in the heart. It's a shame when I talk about the way I think about them, I almost think about them as a little protective coating over the lipid membrane of the blood vessel. And once they get destroyed, then you start destroying the blood vessel and the lipids that make up, myelin and the blood vessels in your brain and your heart. So if you're deficient in plasmalogens, is it either because you're getting old, or you have a disease process, or you have certain genetics like ApoE4, or you have a disease process like you already have some heart disease or an autoimmune disease, or you just are dietarily deficient in plasmalogens. They don't come from a lot of sources, sea scallops, things like that. So if plasmalogens become deficient, you're more likely to cause destructive changes to the blood vessels. And so now we kind of have recognized that coronary artery disease, where we used to think, okay, it's just plaque buildup, right? We know that's not true. So it's not just this lipid accumulation. It's really destabilization of these lipids, probably because when plasmalogens get low, you get more of that, leading to chronic inflammation, mitochondrial dysfunction, oxidative stress, all those things that we talk about in multiples of diseases. So when they measure plasmalogens in people who have coronary artery disease or have had cardiovascular events, they're almost always low. So we do know that there's a connection between these plasmalogens being low and the coronary disease. So I don't think the plasmalogens lower Lp(a), but they lower the risk of the Lp(a) doing damage by reducing the stress to the blood vessels. Heel spurs occur because of the chronic inflammatory reaction where the tendon is attaching to the bone. So you have the plantar fascia, the Achilles tendon attaching to the bone, and that constant traction, that constant pulling, and constant inflammation where the tendon is attaching into bone is what creates the spur. The spur itself is not painful. It's the inflammatory process that created the spur that's causing you the pain. People always, oh, go just remove the spur. Well, that doesn't work. It's stupid. You have to treat the tendon inflammatory reaction. So when the foot and ankle docs do, Achilles lengthening, things like that, that just takes the load off, right? It takes so there's not as much pressure at the tendon insertion. And sometimes that's helpful. That's where stretching comes in important too. But ultimately, you still have to treat the inflammatory process. It's a little bit like arthritis in a joint. So when you see arthritic joints with big spurs around them, like my thumb has here, when you see those big spurs, those are people who have more ongoing inflammatory processes. We know that upregulation of, osteoblastic, sort of this dysregulation, osteoclastic activity, it's very immune mediated. So when we see bigger spurs, there likely are people who have more immune mediated inflammatory stuff going on at the tendon. So what do you have to do? So going back to how do we get the inflammation down in the tendon? One of the best things for tendon inflammation